Hello, everyone, and welcome to another episode of the MedEd Well podcast. I'm so thankful that you've chosen to join me here for another episode, helping physicians take the next step in their wellness journey. And not only physicians, I've heard from other medical professionals and even others in stressful other work environments and other career fields that have really benefited from this. And I'm so thankful for those that have shared, have liked and subscribed, because I am all about helping others take their next step in wellness. And as you know, we're in the midst of a charting series. And today I want to talk about how to manage the mental load while charting as a physician. In this episode entitled Charting Sanity, Strategies for Mental Load Management. So there are a lot of really cool things about medicine. One of the big things is honestly the differential diagnosis, that process of going through all of the potential options that a particular patient presentation could be. It helps go through what's most common, what else should be considered, either from a different body organ system to a different area within medicine. And it just helps flesh out what's going on, what could be going on, and what might we be missing. And that often takes a lot of mental energy and can be one of the most important and rewarding parts of the mental aspect of caring for patients. However, sometimes in addition to thinking about what diagnosis this could be, there's also how many patients you have left to see in that particular day, how many notes you have to do, all the orders that need to get put in based on what you think might be going on, what else needs to happen. Then you have to communicate that with staff, talk to consultants, talk to a patient with an interpreter. You may have to arrange for an interpreter to meet you at the patient room at a particular time or obtain one on video or on the phone. You'll have results coming in, paperwork, modules to do, emails, labs. There is a lot to think about, literally. And there is both a mental and a cognitive load that goes beyond just the little things, the big things, all the things in between that each of us in medicine have on our plate each day. And depending on how we manage that, especially in the area of charting, can make a big impact on how we experience our day. So I am an introvert, and sometimes when I am pouring out emotional energy, investing in my patients, in my staff, and all the things that I have going on, it can be a lot. And that sometimes can lead to some mental overwhelm, especially when early on in my career as an attending, I didn't always get a lunch. I brought my notes home. I was trying to finish up notes at the end of the day saying, all right, how was this patient different than that one, when they both had similar presenting complaints? And I wrote down only the bare minimum, but now I have to flesh that out and actually think through what am I missing? And this was part of what led to my burnout. Mere 8 months out of residency, as I was going through my notes in the evenings and on weekends, and it was just adding up. That mental and cognitive load on top of the physical aspect of running from room to room to room, not getting a break, not having that time to wind down. That in residency, I think I kind of took for granted because I just saw my patients. It was often hard to get to noon conference, but once I was there, I had a little bit of protected time for education, to be able to learn, to engage my brain in a different way. And then the afternoons, while there would be some follow-up on the patients from the morning, there might be some new admissions or consults, but by and large, It was just a different pace than it would be as an attending. And I'm sure many of you can resonate with that. It's not saying residency was easy, because it was not. Those 28-hour calls and the lack of sleep, the amount of things that residents and even medical students are asked to do can be really overwhelming in different ways. Still, mental and cognitive load and overload at many times, but there's just a different aspect of it when you're going from room to room to room every 15 minutes, maybe even asked to see more than 4 patients an hour. It can be a lot. And so my experience with burnout was largely related to my experience of my mental and cognitive load and my experience with charting. And so today I want to address 3 limiting beliefs around charting to help you manage the mental load and restore some sanity to your charting experience. So the first aspect is that I want you to think and to question some of these things, to say, I may have told myself this story, I may have held on to this belief in the past, but I don't have to. I don't have to stay there. I can choose to bring this up and say, yes, maybe that was me. That is me. And maybe I want to change it, or maybe that in some ways serves me. Because sometimes these things, whether it's the perfectionism of having to do my notes this exact way because that was what got me through my rotations, that's what got me honors on this or that, because that might have served me in that situation. I was learning to do excellent patient care. But now when I have to do 10, 15, 20, sometimes 25 notes, it just needs to change. And yet that mindset has been so ingrained throughout medical training that it can be hard to let that go. So 3 of the limiting beliefs around charting to help you manage the mental load. So the first belief we want to question is that I can't chart in the room and maintain or build rapport. So when I finished residency and jumped into practice, I worked with a senior colleague who said that they pretty much got most of their notes done. He was well liked by his patients and those in the clinic. And I thought, how am I going to be able to do that? How am I going to be able to finish my notes and go on to the next patient? Because it seemed like it was overwhelming. It seemed like I couldn't possibly take a history, connect with the patient, document, get the orders, and keep the flow going. And yet, I found that by looking at the patient, by aligning my computer and my line of sight so that I can glance at the chart and back at my patient, being able to type at the same time as they're speaking, I can capture some of those things, maybe in bullet points or fragments that either is sufficient by itself as I give up some of that perfectionism, or it allows me to get some of those things down that I can then more easily go back and edit in a way that reflects what the patient was actually saying. In some situations, it's especially helpful to have a direct quote. And so doing that in the moment, writing down something is super important. And so it's just a matter of saying, where am I now? And where could I take that next step forward? Because ultimately, each of us, if we have access to a computer in the room, we can chart something. We can chart something, and maintaining and building that rapport, it's a choice. It's an opportunity to say, even with this, how can I acknowledge the patient, make them feel heard, and both with my words, my tone, and my body language, be able to say, you matter. No matter how far behind I might be running in my schedule, I am here with you right now. I'm here with you and you matter. And I want to give you my full attention while I'm here with you. So I appreciate your patience, and I'm so glad that I'm here in the room with you now. How can I help you? So the first limiting belief around charting to question is that I can't chart in the room and maintain or build rapport. The second is that the EMR is too complex and I don't have time or knowledge to optimize my charting tools. This is saying it's too complicated, I'm overwhelmed, and I just can't do it. I'll just keep doing what I've always been doing, and somehow it'll work out. I'll still get my notes done eventually. It'll all work out. And this one is sneaky because many of us may have started out in our EMR, either when we started at our current position or when maybe you first were introduced to that medical record system. Maybe your system transitioned after you'd already been there, but ultimately you just left it as the templates that you had because you're like, I have templates, they're good enough. And yet, periodically going back and saying, I want to change this. This is something that I've been updating, I've been adding, and I've done it multiple times. I still find myself with things that I think about that maybe I should change, that maybe I should make more modular so that kind of like little building blocks, I could plug that into this template and then I could reuse that in other templates. But because I have templates for each of the age groups from birth all the way to teenagers, it will take me some time to go back and do this. But one thing that I really encourage others to do as they think about what changes they want to make, whether it's templates, orders, preference lists, is just take a piece of paper and put it by your workstation in your workroom. And when you find yourself noting that you did this again, that you free texted, you typed in this thing and had to change the defaults on this order, just make a note of it. It doesn't mean that you have to change it now. It doesn't mean you have to change it this week, but if sometime this month you could take 10 minutes, 15 minutes, you could make some changes. You could make some changes that really help you out. And so saying it's too complex and I don't have time or knowledge, it's about starting from where you are. It's about having enough self-compassion to say, here I am, and I know that this one little area that I noted, I added, I had to make these changes, that these clicks add up. These clicks add up when there's always going to be more things, more checkboxes, more drop-down lists that you're going to be asked to do. And yet, by looking for these little opportunities, just noticing them, noticing these opportunities that you have to make a change, not for the whole system, but for yourself, because they're your process. This is what I talk about in my group coaching program, Charting Mastery, as part of finding your flow. It's taking the tools that fill your toolbox concept of physical and mental tools. We're talking a lot about the mental tools today, but it's taking those tools and finding your flow. It's saying, here I am, I'm going to make these incremental steps forward so that I'm able to do more in the room. I'm able to do more while still connecting with patients. That first point of building and maintaining rapport, if you know how you always want to do it, if you know that you always bundle these labs together and you put these defaults in, you want to set that up so that maybe even you have a Ryan's diabetes bundle and you just type that in and it brings things up for you. And it can look different for each of us, but it's about being intentional, about looking for some of these things, and then finding a parking lot that you can put some of these ideas in so that you can come back to them. Because each of us can make time for things that matter to us. We see that in other areas of our life. I see that for myself. I recently went to the dentist, and because I have prioritized my dental hygiene since I was a teenager and got lots of cavities, I've definitely seen a significant improvement and a decrease in the number of restorative or procedure-based interventions that I need when I go to the dentist. So first, limiting belief around charting that can help you manage the mental load and restore some sanity to your charting is questioning that I can't chart in the room and maintain or build rapport. Secondly, that the EMR is too complex and I don't have time or knowledge to optimize my charting tools. So one final thing with the knowledge to optimize your charting tools, you might not know what you don't know about the EMR. There might be somebody in IT or informatics, or maybe one of your colleagues that's a super user and really knows their way around your particular medical record. You can just ask, and I learn things all the time as I hear people bring up, oh, how does this work? Well, maybe we could try this. And we just try something until it works, or I realize that that's probably beyond me. And yeah, you're locked out of this particular chart. And to sign it, you're going to need probably to talk to the IT desk. So it's about knowing your limitations, knowing that you can take that next step forward and how to ask for help. But thirdly, the third limiting belief that I want to help you question today is the one that says, I can't finish my charting while in the room before going on to see the next patient. When I graduated residency and started as a new attending, I was still trying to figure out, okay, what's my flow with patients? Which things do I need to look up more because I'm still growing in my confidence as an independent physician. But talking about finishing my charting in the room and going straight on to the next patient room, whoa, that would have been so much if I had even been looking at this particular belief. Because now it's not always that I'm able to. And sometimes things come up or there's complexity in a patient and I have to go back and follow up on particular point of care tests and EKG or something. But by dealing with the discomfort, dealing with my thoughts, my urge to go on to the next room because I'm like, I just want to get to the next thing. It is an opportunity to move forward. So you can finish in the room. You can chart in the room. You can do some. You can at least finish your history of present illness. Every little bit will help you. And so as you think about these three areas, I can't chart in the room and build rapport. The EMR is too complex and I can't optimize my charting tools how I'd like, or I can't finish my charting in the room before going on to the next one. Which of these particular limiting beliefs resonated with you the most? Which of these stories do you tell yourself? Where do you want to change or grow, even in the next few weeks, as you apply something from this episode? I want to encourage you to take that moment. Take 5 minutes sometime today and think about and write down, what are you going to look at? What do you want to change? I want you to post and share this on social media. You can send me an email. You can tag me at MedEdWell. And I want this to be an action-taking episode, a catalyst for you to make that change. And if you want to go deeper in optimizing your charting so you can finish charting faster and get home sooner for what matters most to you, then I would love to be your coach to help you look at some of these things, these beliefs, these thoughts that come up. I call them sneaky thoughts, these unintentional, automatic thoughts that our brains like to offer us. Because as we bring these up, then we can see how that's affecting us, our feelings, what we end up doing or not doing, or the things that we try and task switch just to get out of it and procrastinate because sometimes sitting and doing some of these things is uncomfortable. And I felt it too. And that's why I wanted to help other physicians, other medical professionals get their charting done faster. So I'm currently enrolling for Charting Mastery, my 6-week group coaching program designed to help physicians finish charting faster. But I'll also have a course and some one-on-one opportunities as well coming up. So I encourage you to subscribe, to get on the email list so that you can be one of the first to know about these opportunities. Thank you so much for joining me today, for listening, for sharing these episodes. I'd encourage you to share this with another physician or medical professional who would really benefit from engaging with these concepts today. And please keep prioritizing your wellness, because as you do that, you are better able to show up for yourself, for your patients, for your family and friends, and for your future. Thanks so much for joining me and for all that you do. Have a great day.